Hi, I'm Darnell with Live Young Lifestyle, and once again, I'm here with Dr. Dan Yamini at Sunset Cosmetic Surgery, and today we are talking about Sculptra versus fillers.
So you've had fillers before, you've talked about fillers.
I do fillers in my hands.
And you can get right down to the area that you want to be in to deposit the product.
I have done fillers over the years. I've kind of cut back on a lot of the fillers that I'm doing and have opted for more fat transfer and things like that, and little tiny bits of filler. But Sculptra is very different.
Sculptra is different. So back in the 90s, a lot of patients were having lipoatrophy, loss of facial volume from treatments of HIV. So the manufacturers created a product where you would implant these tiny particles that are biodegradable, and they would help stimulate collagen. And the hollowness in these patients' faces would go away. So back about 20 years ago, they launched this product called Sculptra, and there was a lot of research behind it, and they would inject it in all the areas of the face that were hollowed from these HIV therapies.
Right.
And they realized patients were getting really nice volume restoration. They looked better and they looked younger.
Right.
But it's a very gradual process. So it's different than your traditional filler, where you inject this gel into an area and it puffs up.
Puffs it up.
This is a product that...
This isn't instant.
This is an instant. No, this is like planting seeds in a garden. Okay?
Oh.
So you get the powder, you mix it with water. So all these little particles of powder are in there. Then you inject this water into a region, the whole spread of area, not just in one little specific area like you would a filler.
Right.
The water goes away in a few days.
Okay.
Then the effect of the fullness goes down, and then over a period of 3 to 4 weeks, these little particles, which are actually the same particles that absorbable sutures are made of. We've been using it for 50 years, so this is not a new molecule.
Right.
Polylactic acid has been around for decades.
Is it the same that they're using for threading these days?
Yes, it's the same absorbable,
which also
biodegradable,
stimulates collagen,
correct.
Right? So these are little particles
right,
of that.
so they've made a powder version of it. We liquefy it. We spread it throughout a whole region, throughout the face, anywhere where you want gradual stimulation of the collagen,
Got it.
Hands, face, neck.
So not all injectables are created equal. Just because you're injecting it in your face and it's filling up temporarily, it does not mean that it's a filler. This is actually more of a collagen stimulator.
It's called a biostimulating
a
agent, yeah.
But where would people generally
People
use
who
this?
have very hollowed face, whose skin texture is not you. This is not ideal for your face.
Okay. But if you had like a hollowing under your eye?
If you have hollowing in the temples, if you have wide regions of your face, like the whole cheeks, the whole temples, where you need to gradually build volume, not puff it up with a filler. So little older patients, people who have lost the volume in their skin and all the tissue under it, this is a good sort of a gradual step-by-step process.
And this doesn't make you look like not yourself. It's not those, the crazy things that are happening on Instagram where people are not looking like themselves and giant lips and all that.
This is not for big cheeks, big lips.
This is just getting back that youthful appearance by using your own collagen.
Yeah, stimulating your own collagen to grow the natural thickness of your skin and the natural tissues under the skin.
Where have you used this?
Pretty much everywhere. There are some doctors who actually do butt augmentation for skinny women who don't have any extra fat to do a fat transfer or Brazilian butt lift. They can spend a ton of money getting a lot of this product injected for temporary butt enhancement. So that's been in a little bit of a rage recently. I don't do it. I believe in doing traditional fat transfer.
Those are like the gazillionaires of the world.
That'll cost you over 100 grand.
Wow. But it's kind of growing a butt naturally.
It's stimulating the own collagen in your butt for very subtle. Today for you, we're going to address just some of these lines here, We're not going to really do this to add volume. It's just to build some collagen for the skin that's showing a little bit of laxity right there. That's right.
Okay, let's do it.
All right, so let's put your hair back. Okay, you ready? okay? That bump is from the water that's mixed into this. So over the next couple of days, that water will get absorbed, and all that's left behind is the actual particles that are going to lay the foundation and help stimulate collagen in that area.
I didn't feel that at all.
Good. So the numbing is already mixed into it. So the water in there fills up the crease or the wrinkles immediately. So it gives you an appearance of instant correction. Now you may bruise from this. That's normal. Like any injection, it's anticipated you may bruise. And to help with the healing, they do recommend that you massage this to help spread all the particles. Okay?
Oh, really?
Yeah. So massaging, unlike other fillers, this is a product that we do recommend you massage it on a regular basis for a few days.
Now, how often should I massage this at home?
Every few hours you can massage it for a couple of minutes, and it's normal to have a little bit of swelling. For the face, we're a lot more aggressive with the massaging.
Unlike filler, does filler already come pre-mixed?
Yeah, fillers, hyaluronic acids are pre-mixed. This is one of the only biostimulatory fillers or volumizers that actually we have to mix. It comes in a powder.
Okay.
So we did it here already. Okay, we are done.
Ooh.
All these areas of swelling will disappear over the
Yeah.
next couple of days. And just massage it with your favorite lotion.
Okay, and when do you think the peak of this is? Like
Probably
in
about a
month?
month you'll see the results.
Okay.
Yeah,
And they
Yeah.
last?
about a year.
Okay.
If you're putting enough in there, it could last up to 2 years.
Right.
But most doctors recommend you continuously replenish this, probably on an annual basis.
Right. So remember,
Okay.
we're not, by replenishing it, we're stimulating our own body to
Exactly.
produce the collagen. So
Produce
you're
more collagen.
basically just saying, hey, make more collagen.
Because this stuff is bioabsorbable. It's
Right.
just like the same sutures we use that are absorbable. The body absorbs it, but it leaves behind a stimulation for collagen.
Right, right.
Okay.
And that is a really good way to live young. Getting your own body to make its own collagen, come on.